Hello, I'm Hannah and I will be administering medications today. So when starting to administer a medication, you want to make sure that you're only doing one client at a time. And then you also want to double check and do assessments related to the medication and then note any specific parameters. So these could be checking the blood pressure, pulses, things like that. And then you want to complete your first check. So you're going to use the med order on the MAR and check that with the med dispensing system. So you're first going to want to check the name. So on the MAR, it's Jan Doe. And then you're going to want to do the patient identifier. So you're going to want to check the name as well. And then you're going to want to check the dose of each med and the med names, which are all right here. So it looks like we're giving 4 meds today. Acetylsalicylate sodium, 81 milligrams, glucofig, 500 milligrams, potassium chloride, 10 MEQ, and pilocarpine eye drops. And those are 2 eye drops. Each eye 4 times daily. And then you're going to want to check the route. So they're all by mouth except the eye drops. Those will be by eyes. And then the time is 8 a.m. that we're supposed to be administering them. And then we also want to check for any documentation or allergies. So it does state there are no known allergies on the MAR. And then along with that, you want to check for special considerations before administering and preparing. So you might have to crush up the meds or put them with like different foods depending on the patient. And then you're going to do your second check when preparing the meds. So that includes checking your client again, so Jan Doe, the medications. So I actually already got them ready. So here's that one, each med, and then the eye drops. And then you're going to check the dosage. So they're all the correct dosage except the potassium chloride. So that right now is at 20 MEQ, and it needs to be cut in half because on the MAR it's 10 MEQ. And then the time again, which is 8 a.m. So we're giving them at that time. And then each route, again, they're all by mouth except the eye drops. And then we want to check the expiration dates, which these are all good. And then any documentation and allergies, again, associated with the medications, which they have no known allergies, as already stated. And so now we're going to calculate the dosage and make sure we're doing that correctly and then get the meds ready. So I would have on gloves if I were to cut a medication. So I'm going to take the potassium chloride out of the package. And use my pill cutter. And we're just going to cut it in half. Down the middle, and then we'll just set that over here. And then these 2, they can stay in their packages and go, this is my med cup, so they're going to go into there along with the pill, and then the eye droppers. And then we're going to do our third check at the bedside, ensuring that it's the correct client. So we're going to use 2 methods of ensuring that. We're going to check the ID band and then also the MAR. And then, so it's Jane Doe once again. And then we're going to make sure that we have all the correct medications by double checking the MAR. So it looks like they're all correct. And then we're going to check the expiration dates of each, which we already did, but just double checking. And then we're going to check the dose of each. So I did cut the pills, so now all the dosage are correct. And then the route, so the pills in here are going to be by mouth, and then the eye drops I will be putting in the patient's eye. And then the time, it is 8 a.m. And then we're going to check for any more documentation and presence of allergies. And then before administering the medication, I would do standard precautions, hand hygiene, check for safety, body mechanics, and privacy of the patient. And then I would introduce my name to the patient and check their wristband once again. And then I would properly position the patient to receive the pills. And then I would give them their meds. So if they can do it themselves, then I would just give them the meds for them to take and have them give them a drink. If they can't do it by themselves, then I would simply take them out of their packages and tilt the medication bottles over for them by their lips. And then again, I would make sure that they have water to drink or some type of drink for them. And then once that's done, I would stay there and make sure that they do take all the medications and not leave anything unattended. And then I would go and move on to the eye drops. So I would perform hand hygiene after that. And then this is the eye. So I would use my non-dominant hand and pull down the lower eyelid and expose the conjunctival sac. And then I would have the patient look up, and I would open these while still holding this down. And then I would have the eyedropper 1.5 centimeters to 2 centimeters above the eye, making sure not to touch the eye or eyelashes or the cornea. And then I would put in the two, while the patient has their eye up, I would put in the 2 drops, because that's the ordered amount. And then I would have the patient slightly close their eyes. If the eye drops do fall out, then we would just repeat this process. And I would also do that for her other eye, the same steps. And then, so then after the eye drops are in and she has she closes her eyes for a little and rolls around her eyes, then she could open them back up. And I would tell her that there may be some burning depending on the eye drops in her eyes, but that shouldn't last long. And then I would make sure I don't leave the eye drops there unattended. And then I would perform hand hygiene. And then I would document the meds on her med record and reassess for therapeutic effects, side effects, and adverse effects. And then make sure she's in a proper position when I leave the room. And that's that.